I'd like to mention two things about the pelvis. The pelvis is the area below the abdomen, above the hips. It's the lower trunk. And musculoskeletally speaking, we're talking about the bony ring. And I want to point out that it is a ring of 3 bones on the left, 3 bones on the right. We call the left and the right innominates, but it's made up of the ischium, the ilium, and the pubic bone, each on the left and the right. And in the middle, those connect to your sacrum or tailbone at the sacroiliac joints, because the sacrum meets the ilium on the left and the right. We abbreviate that the SI joint. And on the left and the right, you can see that we have hip joints where the femur bones meet the acetabulum, which is a part on that lateral pelvic ring where the 3 bones of the innominate meet. So my point is, when people talk about lack of pelvic rotation or pelvic instability, or they use any number of words, I want people to recognize that this is usually quite vague, and I challenge people to be much more specific with their language. The pelvis not rotating well, to me, doesn't tell me anything, because the pelvis is comprised of joints that are individualized. So you need to know, well, is the left SI joint not moving well, or is the right hip not moving well? I will also add that the lumbar spine, the low back, is adjacent to the pelvis. So mechanical problem or problems with movement in the lumbar spine can affect how the SI joints or the hips move. So try not to be vague with using words like pelvis. When we're talking about orthopedic disorders and something's not performing correctly, we want to identify that and name it. Is it the L4 joint, or middle lumbar spine, or lower lumbar spine, or again, the left hip? We need to identify it, because the more precise we can be with the problem, the more likely we are to get a successful outcome by matching a very specific treatment to that precise diagnosis. So be cautious with using words like pelvis when you can be more specific. Secondly, I want people to recognize that just like any part of the body, the pelvis, that region of the body, receives innervation from spinal nerve roots. So if something's going wrong in the pelvis, whether it's the reproductive organs, the genitalia, the musculoskeletal structures like muscles, or just ligaments, tendons, any number of things, if there's something going wrong there, you also want to consider if that something going wrong is predicated on a spinal nerve root issue. Spinal nerve roots, starting in the lower thoracic spine all the way down to the coccyx, are going to be largely responsible for power and innervation to the region, meaning the musculature as well as the skin. So if something doesn't feel right, pain, numbness, paresthesia, it may be, not always of course, but it could be as a possible diagnosis that a nerve root exiting the spine anywhere in those regions is being irritated, and it can be reversed by reducing that irritation. Sometimes reducing that irritation means it's a mechanical problem, and we just need to move the spine in 1 or 2 directions to free up that irritation and get things mechanically moving well again, and therefore feeling normal again. So at the end of the day, be cautious with ascribing problems to pelvic motion, be more specific what precisely isn't moving well, and be cautious with attributing signs and symptoms to problems in the pelvis in particular, without considering that the nerve roots that innervate the area could be part of the problem, if not the entire problem.